Hi everyone, this is Dr. Spenser from Brant Wellness and Rehab in Brantford, Ontario, coming at you with a helpful video today all about chiropractic and what you can expect on your first visit to a chiropractor. This video is great for anybody who's thinking about seeing a chiropractor or wondering what they should expect when they first go into a chiropractor's office and meet them for the first time. This will help you understand our approach, what we're required to do, what we should be doing, and how it will help you at the end of it all. The first step is when you first go to a chiropractor, you'll probably fill out some paperwork, which is pretty standard in most offices. Now, after that, you'll be taken in to see the chiropractor, and at that point, he or she should be doing a very detailed history with you. This requires a lot of questioning, and this helps us formulate a diagnosis, which is what we're ultimately working towards. Whether you have an injury or just pain that you don't know why, we often see these types of things in our offices, and our first goal is to figure out why that pain is there, and that's where the diagnosis comes in. So the first step is the history. Again, a lot of questions about the pain that the person is having, about past injuries as well, and other important health information that might be necessary to ask depending on the case. After that's done, the physical exam should take place next. This can be comprised of various tests that the doctor will do, neurological testing, range of motion. Perhaps they might refer you for x-rays if they need to see something further. But this physical exam, again, helps us determine what the diagnosis is and ultimately how and what we're going to be treating. So once the history and exam are complete, the chiropractor should be presenting the findings to you. What they found, what it means. This might happen after the exam. It also might happen on the second time you see the chiropractor. It depends on their approach, but either way, you should at some point be told, what they found, what it means in layman's terms, and what can be done or not done about it from a chiropractor's point of view. Sometimes we need to add other therapies to help people move further along or reach their goals, such as massage therapy, physiotherapy, and all those things can be incorporated into an appropriate treatment plan. So once that's presented with the diagnosis, the treatment should begin. And I'm not going to get into that part today, but I wanted to give you a good idea of what it should look like when you first go in. Also, when they're going through the exam with the chiropractor, they should be explaining to you what they're doing. At no point should you feel uncomfortable. If you do, they should be able to realize that or communicate that ahead of time. They should be explaining every step along the way so that you know exactly what's going on. And if you don't want to do a certain test that they might require you to do or want you to do, then you can always not to do that. Sometimes we are doing range of motion, and sometimes people might say, you know what, I know it's going to hurt if I have to bend over. I don't want to do that, and that's perfectly acceptable. It's all should be done within your comfort zone. So I hope that helps. I hope if you have any questions as well that you'll comment below. And if you have found this video helpful, share it with those who might be thinking about seeing a chiropractor or sort of on the fence. And if you'd like to learn more, just let me know. Thank you. Have a good one.